In this video, I will use my two patient identifiers to identify my patient. I will do my 3 medication checks, follow my 11 rights, and practice general safety measures and principles. So first, I am going to wash my hands. I'm going to identify my patient. So, hi, my name is Violet. I'm going to be your nurse today. Can I get your name and date of birth? Okay, do you have any allergies? No? Okay, have you ever had an IV before? Okay, today we are going to be putting in an IV and doing a push medication. I've already checked the medications with the drug book, and there will be no adverse reactions and everything will work together okay. So I'm going to wash my hands again and provide privacy. I'm going to don my gloves. I'm going to tie my tourniquet 3 to 4 inches above the injection site. I'm just checking to find a nice healthy vein, bouncy, and I'm going to check the pulse to make sure I can still feel it, and I can, so it's a good vein. There's no edema or redness or swelling, so this is a good injection site. So now I'm going to go over here and check all my supplies, make sure nothing is expired or opened. And I'm just going to clean the site for at least 60 seconds up and down. And I'll let that air dry. So while it is air drying, I'll get my supplies ready. I will be using a 22 gauge 1-inch needle for the IV catheter. I am going to prime my J-loop. So I will just open up this alcohol wipe, scrub the hub, and put on my saline flush, and I'm going to prime it. So it is primed, and I will put it back in its package just to keep it sterile. Now that the site is dry, I'm going to tie my tourniquet back. And making sure not to touch the site again once it is clean. So I will just use my needle, bevel up, and holding the skin taut. I'm making sure that the catheter is flush with the skin. And I will push my safety and put this in the sharps container. So I will release my tourniquet and hold pressure on the vein just to stop the bleeding. Now I'm going to attach my J-loop, making sure to keep it sterile and holding on to the catheter. I'm going to check for a good vein. So I'm going to push, aspirate, and push, so I have made it in a good vein. Now I will tape. Making sure to not let go of the catheter. And I'm just going to use my transparent dressing that I made from tape. Making sure to hold on to it. Okay. Now that the catheter is in, I will just undo the flush, open up a new pack of alcohol, and scrub the hub, and putting a cap on it. I'll go ahead and tape that down. Okay, now that I have that done, I'm going to go ahead and get my medication ready. So And while I was getting cleansing the site, I would have got my tape together, but I already did that before. Now I will be using a 23 gauge 1-inch needle to draw up the medication that is prescribed. I have already looked in the drug book, and I have done my 3 medication checks just to confirm. So I'm going to clean the vial and draw up the correct amount that is prescribed. And I'm just going to use the scoop method for the needle just till I'm ready. And okay, I'm going to take the cap off and throw this in the sharps container. Now I will take the cap off and scrub the hub. I would have left the cap on for the medication before I did the flush. I'm going to flush before injecting the medication at a slow rate, just assessing to see if there's any infiltration, edema, redness, or swelling. There is none, so just going to flush, aspirate and flush. Scrubbing the hub again. Now I'm ready for my medication. I'm going to inject, push at the rate that is prescribed, slowly. Scrubbing the hub again. I'm going to push the saline at the same rate that the medication was prescribed, slowly. And scrubbing the hub again, and I'll put the cap back on it until I'm ready to do another push medication. I will come back in 15 to 30 minutes just to assess the site, making sure there's no redness or swelling. I will check to see if the medication is working, and I am going to take my gloves off, report and record, document, and wash my hands, and